Okay, so tendon diseases basically. So there are different types which I'll go through. Hyperextension deformities is first. The example they've mentioned is flexor tendon laxity, flexor tendon laxity in calves, which leads to hyperextension. It's not painful, but you can see the gait is going to be very abnormal. How do you treat it? Well, if it's mild to moderate, you just need to give them limited exercise. Why is that? It activates something called the myotactic reflex. Sorry, it's quite small now because I've made it sort of half screened. So yeah. And this basically strengthens and tones the muscles, the tendons, and the ligaments. What you can also do is glue a thin wooden block or rubber block to the hoof with methyl methacrylate acrylic, and this enables heel extension, basically. There are also flexural limb deformities. What does this result in? An inability to normally extend the limb in cattle. I'm not sure this is the best one, if I'm honest, but okay, we'll give that a try. So yeah, how do we treat this? Usually you don't need operations, but bandaging for a few weeks might help. Now, if it's moderate, obviously just bandaging and NSAIDs for pain. Now, if it's a calf, especially because they're still growing, you could use a firm limb bandage, but leave the toes open so the tendons strengthen, because imagine the toes will mostly be supporting the body weight. And actually, this tab is actually for arthrogryposis. Now, this is a persistent joint contracture that's present at birth, and it's usually in cattle, as you can see. So this results in what we call arthrogryposis. I imagine this is the flexing of the limb. Just Google it. Kyphosis, you can see arching of the back. Torticollis, don't know what that is. Scoliosis, I think it's like when the back is bent. Cleft palate, can't see it here. And it can be lethal, because it can lead to necrosis of the skin, carpus necrosis, septic arthritis, and there are a number of predisposing factors. So maybe this calf had ancestors that had double muscling, maybe it's male, and we usually treat all of this by desmotomy and tenotomy of the contracted penarticular soft tissue. So basically doing a desmotomy and tenotomy of those tendons that are causing the arthrogryposis. Next, we have septic tendinitis. So this is obviously caused by infection, usually due to injury. Some really key ones they've mentioned here are like subsolar abscess and ulcers, which we'll actually get into, and it may involve the deep digital flexor tendon. If you see the letters DDFT, that's what it means, or deep digital flexor avulsion. Anyway, so we treat this by surgical debridement, so removal of the dirt, cleaning the area, of course using antibiotics and anti-inflammatories just for pain. But obviously the antibiotics have to be based on the culture you do, because obviously it may not be effective. The last two are quite self-explanatory with laceration. I don't know if I have a picture here. Okay, this is a surgery, but imagine this has been lacerated open. It's usually in the hind limbs, in the mid-metatarsal region. And yeah, of course, a wound can lead to infection. Now, with tendon rupture, again, it's usually because of trauma, but it's usually in the area of the gastrocnemius musculotendinous unit, meaning, okay, so the gastrocnemius is the calf muscle. Let me find calf muscle. Didn't write that incorrectly. Gastrocnemius. Okay, so sorry about this. I should have had this ready. So the gastrocnemius, yes, is this bulgy thing here. So it's usually some injury here or higher up, where you'll get a tendon rupture, and it can be near the insertion of tuber calcaneus, and it's associated with septic tendinitis, which we've already spoken about, necrosis, sepsis of the peritendinous tissues. And how do we treat this? Tenorrhaphy, which you'll have to Google, external coaptation, rest of course, and putting a rubber block on the healthy digit, and of course some corrective Faggery and NSAIDs for pain. And is that everything? Yes, it is.